Hi, this is Lucinda Nord with Indiana Association of United Ways, and I am joined by Stephanie Berry and Leah Gonzalez for this kickoff meeting of our kindergarten countdown planning for 2015. We have folks from all over the state on this call, from Delaware, Hamilton, Lawrence, Orange, Monroe, Stark, Tippecanoe, Tipton, counties already, so we had a couple people who couldn't attend, so that's why we're recording this session. So thank you all for joining. If you have questions, please type them in the chat box or in the question box, and we will get to them. So let's get started. So what we hope to do today is to confirm the contact information for local relationships, explain a little bit about what is similar and what is different about our 2015 planning, and then talk a little bit about, have IU Health talk about some of those differences in terms of some of their intensive focus and the Barnes & Noble book drive, and then talk a little bit about our 2015 goals and timeline. So this is our first guess of our contact numbers. So if any of this information is incorrect, we would like you to make sure that we have your correct email and phone. We will send this back out as an update to everybody. So I'm looking online. We have a couple new folks on our side from the United Way perspective, but not so many. We have a lot of the folks who've done this before. And from the IU Health side, Leah or Stephanie, you want to jump in about some of your changes?
Sure. Mindy Lambden, I believe, is new in Orange County. Rhonda Jones with White County. And I believe that might be, and Claire Steamer up at LaPorte.
Okay, so I'm looking to see if there are any questions. And yes, we can see your questions, Maria. And we've got, oh, great. The whole team is together in LaPorte County, so my apologies. We have Claire, Maria, Chris, and Kim all together. And we did send out the slides earlier today, so if you would like to print those, they should be in an email from me from early this morning. So those are the questions so far. All right. If any of these changes might need to be made, I think we might have one change. My apologies, I do not have Blackford County on this list. That was my mistake. So my apologies, Mr. West. And I think we may have a school change there because I understand Dr. Stokes might have taken a different position. So we will try to get that information, and I don't, so my apologies to all our friends in Blackford County. So we all know that, I just love this picture, what Kindergarten Countdown is, just as a quick review. It started with United Way of Central Indiana. It has been expanded over the last 5 years. Last year we at Indiana Association of United Way supplemented it with, over the last few years we have supplemented it and expanded it through other grants. So the map on the right includes the counties on this call are either in red or purple, which reflects the type of dollars that are helping support those camps. Everyone here knows, I think, but for those who might be new, the camp design is pretty standard, although last year with all of the snow days, it affected some of our camps over the summer, had to be shortened. But generally a kindergarten camp is 4 weeks, half day in a school with qualified teacher and often assistants. IU Health volunteers are to be there every day. We used an approved curriculum, and all the students take a pre and post test for pre-literacy skills, and while it's not the greatest of assessments, it is something that offers us a standardized way of assessing our outcomes during this camp. There are some optional elements to the camps in terms of transportation. Most of the camps offer some sort of transportation, not all. Most of the camps offer some sort of snacks and meals. often provided by the school as it's connected with their summer school programs. Some of the local communities will also do a book supply, or excuse me, a school supply drive and IU Health Supplies backpacks. And then sometimes the local community will offer field trips as well, though those costs are generally not part of the IU Health grant. This just gives you a quick synopsis of the pre- and post-test results from last year for those schools that were touched by IU Health volunteers. And on average, we saw about a 21% growth in pre-literacy skills on the Get Ready to Read revised assessment through Pearson. So that gives you just a quick snapshot. All of this report is available on our IAUW website, iauw.org. You scroll down and there's a whole section on Kindergarten Countdown. Some of the other features that we'd just like to highlight for you is that we're really trying to build awareness about kindergarten readiness in the community, trying to encourage. We know lots of good teachers already use a lot of action-based learning and student portfolios, and trying to make that handoff to the kindergarten teacher much more structured so that those children and their parents and their teachers all feel ready. We've really worked on engaging parents and volunteers in this process so that it's not just a school-based program, but really looks at rallying the community around these kids, because they are often the kids most at risk of falling behind their peers. And then really looking at how do we leverage additional funding, strengthen our relationships so that this is really about a community rallying around these children. And then it has very specific results in increasing school readiness, both in the pre-literacy area, helping kids with understand their numbers and their letters and their colors and being able to identify their name and do activities, but also very important that we hear from the kindergarten teachers are the social and behavioral skills. Children who've maybe never eaten lunch at a table, never stood in a line, never known when it's quiet time and when it's playtime, and all of those sort of social behaviors that happen in school are so important to learn over that kindergarten camp period. So I'm going to turn it over and now we're going to have IU Health present part of some of the differences as we talk about the different roles. So if you can, Stephanie and Leah, talk a little bit about some of the differences from an IU Health perspective of this year versus the prior years.
Sure, absolutely. We'll chime in. We just wanted to share that, this year, and in the past, in many ways, we've always really tried to focus on schools that were located within IU Health communities that have been identified primarily by the IU Health Hospital as being those that are kind of right outside their walls, or those that the individual team members, IU Health team members, would really like to support and provide some volunteer time within. So we are, I guess you could say, having a more intensive focus on kind of those schools within IU Health communities. And we're asking our IU Health partners to identify about 2 schools that they would like to have their camps within. And so those will be where IU Health volunteers will be present and working with the teachers and the students to continue to provide some of those meaningful volunteer opportunities and really make an impact with the students. We will be distributing t-shirts and backpacks to our IU Health designated camps. And we're also excited about a partnership with Barnes & Noble where we're trying to raise 9,000 books for Kindergarten Countdown. So we're very excited. We have 4,500 books currently right now and 4,500 more to go. And we're very confident that we'll be able to reach those numbers come end of April. Additional information, again, we are looking forward to being able to with the United Way's help, to identify schools where iStar-KR is being used locally so that we can compare that data amongst, the readiness for students. And we also look forward to receiving some budgets and information on action-based learning and attendance and demographic data so that we can share that with our leadership as well. And of course, we always appreciate being recognized, but again, that's not our, especially wearing our community benefit hat, that's not our sole purpose by any means.
This is Stephanie. I'll just add to what Leah shared, which I think in most of our communities we've done a really good job of selecting schools that have been selected in partnership between the Indiana Association of United Way and the IU Health Hospital. I think there's just been a few instances maybe where schools were selected and they were 30 to 40 minutes away, and ideally that just makes it difficult for our volunteers to be able to travel there, over a shorter period of time, a lunch hour. And so really just would ask that, that we try to limit the camps to 2 to 3 schools per county, and that way from a budgeting standpoint we can be sure to stay within our budget guidelines, and then also have schools where the IU Health volunteers can more easily and more readily be able to volunteer. So that's really our ask and a little bit of our rationale in trying to make sure that we have 2 camps that are IU Health focused, and we can make sure that every kid that's in an IU Health sponsored camp has a backpack and t-shirts and books and all the things that we want to make sure that as an IU Health model happens. So that's really just a little bit more on what we're looking for.
And just so that everyone knows, we have had conversations about, we know that there are some sensitivities about, especially if there are more than one classroom in a given school, that we know that some of you are very sensitive to perceived inequity between, children in this classroom and children in that classroom. And if there's any question like that, we'd like you to just raise that to us. But this narrowing the focus to really make sure that those limited camps have sort of the full support from IU Health. That's something that we can have an ongoing conversation about, but that we wanted to at least give you the idea of that direction. IU Health provides a substantial financial contribution to support this, backpacks, t-shirts, and again, we can certainly have those conversations about some of your schools where there might be more than one camp or kids who cross over. The volunteer contribution from IU Health, they're making a great effort, and then you just heard Leah talk about the Barnes & Noble book drive, which we're very excited about with their progress to date. From an IU Health local role, I don't know if you want to talk about this. This has been sort of our normal ask of our IU Health local hospitals. Leah or Stephanie?
Sure. Yes. Again, I believe we've had the opportunity to kind of share this each year, but we always look for greater input in identifying locations for kindergarten countdown camps. So again, we can be kind of cognizant of maybe where the schools are in relation to the IU Health Hospital. And we would ask everyone to participate in our Barnes & Noble book drive. We'll be kicking that off in April. It'll be the week of April 19th. So if you do have a Barnes & Noble location nearby, please be on the lookout for an in-store event during that week, at some point during that week. And then, yeah, we're always excited about recruiting team members to volunteer within kindergarten countdown camps and just continuing to promote the awareness of kindergarten countdown so that those children in need that would benefit from a kindergarten countdown camp have the opportunity to attend. And if there's any additional support, again, in-kind support that a school or a camp may need to be successful, please keep us abreast of that.
This is Stephanie, and I would just add a couple of other things. I think a couple of examples from in the past for in-kind support. I think one year at the Tipton camp, lunches were provided from the IU Health Tipton Hospital through box lunches taken over to the kids. So that's a great example of in-kind support. I believe one year down in Bedford, Lawrence County, I think it was a collaboration that worked to get the city buses to pick up kids for transportation. I know that solely wasn't IU Health support, but again, just a great collaboration to make sure that transportation was provided for those kids. And then I think the other thing, just kind of going back to Lucinda was talking about T-shirts for all the kids, and I would certainly say ideally we want to choose a school where all the classrooms can receive T-shirts. We certainly don't want, just because you ended up in one classroom versus another classroom, that you're not going to get a T-shirt. So definitely keep us abreast of any situations or challenges like that as you choose your school. Let us know. And then I think the other thing that would encourage all IU Health hospitals to do on a local level is we hope that everybody is conducting a local United Way campaign. And I would just encourage, A, that that's happening, and B, the idea of opportunities. What we typically have done here in Indianapolis is provide a designated contribution to support the Kindergarten Countdown Camp. So just make sure that everyone's aware of those opportunities to support your local United Way and hopefully your local Kindergarten Countdown program.
Great, thank you, and we certainly appreciate that from a United Way perspective, and this is a great story to tell in terms of the impact. So in terms of the role from local United Ways through IAUW, the local United Ways are helping coordinate the schools, the teacher, the transportation, the meals, supplies, the pre-test and the post-test. We actually purchase those, just so that all of our folks know. We have a group purchase basically of all of the Get Ready to Read materials, and we ship those to you. So we'll be organizing those MOUs and the order numbers for those assessment tests, and if anyone needs additional curriculum, which we have used, if you choose to use the Cozy Corner curriculum, we know that a number of schools have their own curriculum that they have chosen. A lot of our local United Ways also supplement and provide their own volunteers or interns or student recruits, and then help with some of that local promotion. I give a shout out, Stark County last year, the Community Foundation was just fabulous in posting all kinds of material and putting an intern there in the school. We've had some great examples. Lafayette has just done a fabulous job with securing additional funds and putting all kinds of wraparound. We had a couple of our United Ways were able to mobilize some additional supports to allow those field trips or other sorts of supplies. So we encourage all of that, and we provide those sort of tools and templates. IU Health also has some internal resources for their staff. Stephanie or Leah?
Additional templates, yes. So I think everybody from IU Health is aware on the print-on-demand system, we've created templates that you can update and print locally. So, we have things like a flyer that can be sent home to the parents to let them know about Kindergarten Countdown, and also reminding them of the importance of reading every day, as well as some posters, and as well as flyers to help recruit volunteers for Kindergarten Countdown, and then of course a PowerPoint presentation we can share with you so that you can go out and help recruit volunteers or share the message in the community. And I know Lucinda has shared in a couple of communities, they have expanded from just having IU Health volunteers in the classroom to having community volunteers as well. And I know Orange County is another community that I think is wanting to look at that model. So again, a PowerPoint that you could take out and share, or a flyer that you could take out and share with either volunteers or community members. And then, where should you be promoting awareness? Town or employee forums, any department meetings, if you have leader meetings, manager meetings, director meetings, PTOs, any place really that you can think of would be a great place to promote the importance of kindergarten readiness, and then specifically the Kindergarten Countdown camps and the roundup events that may occur in some communities.
Absolutely. And I would just add, again, all the flyers and posters and table tents are on the pod, and we're working to get those the pictures from last year up on the pod and the bag as well. So we've been working with Michelle and Nikki on that. We just got some final approvals and just have to coordinate with them logistically regarding the meta tags, which I just recently learned about. So, again, be on the lookout for those new pictures as well in the coming weeks.
Great. And then lastly, before we open it up for conversation and dialogue, we just wanted to go over some of the next steps. So if you have not already held a local meeting between the United Way and the IU Health staff, it's probably time to schedule that local meeting, and also with your school, because I don't have to share with you. I think most of you see the kind of pressures that schools are under right now, and some of the schools who may have been able to be very generous with in-kind contributions may not have the same sort of resources, or I know we've had a couple staff changes at a few schools. So it's probably good to, if you haven't already had that conversation with your local school, try to nail down some of those dates, the opportunity for recruitment, whether it's through a kindergarten roundup opportunity or some other way of identifying the kids most in need, so that you could identify which school location and the dates again. It's our goal that we will have that all of the registrations for the camps will actually include t-shirt sizes this year, and that we'll get those by May so that we can put those orders in to IU Health and they can do the appropriate shipments. I know we had some camps last year that started the first week of June, and we ended up with odd sizes, and then by the end of the summer we had some camps without. So we want to make sure that that's well planned out this summer, and getting the registrations to include t-shirt sizes and photo releases and all of those other materials that we've talked about on a prior technical assistance call with our United Way folks. We'd like to have that by mid-May. It's also time to start recruiting local volunteers and staff, whether that's seeing if your teachers from last year will come back, what other student teacher assistants you might need. I know I've heard from a couple folks that they have some staff changes that they might be seeing over the summer. And then from a central planning perspective from IU Health and IUW, we're completing the MOUs, and then I'll be completing the grant agreements with each of you at the local level. From the United Way perspective, both of our organizations provide technical support, templates, and materials to our local hospitals and local United Ways, and then we hope for just a fantastic year again with kindergarten camp. So at this point, what we'd like to do is open it up. So I know that some of you are on your computers and some of you are on the phone. So I'm going to unmute you. If we hear a lot of background noise, we might have to go back and mute some folks. So I'm unmuting all of you. If you're not paying attention, we will hear you eating your lunch and doing everything else that you normally do while you multitask on a webinar. So hold on just a moment, and here we go. So I'm starting to hear everybody. Hello? Okay, so I'm hearing lots of breathing, and typing. So you're all unmuted now, so we can all talk. Is there any question from the group? Any questions?
So will there be a list that will be coming out of all of the area locations and the number of students per location?
That will, and who is asking the question?
Oh, I'm sorry, this is Michelle from Tippecanoe County, and we support both White County and the Tippecanoe County area.
Okay, so what we usually encourage, first for White County, it tends to be the same school, and you'll talk with Ellen Bartlett for that. And then for Tippecanoe County, because Lafayette United Way has a very robust kindergarten countdown program already, far beyond the IU Health, you'll want to have some conversation with Laura Carson and Amy O'Shea, if you have not already, to identify which of those schools that you really want to sort of identify as IU Health schools.
So that we will only, because in the past we've supported all of those schools with school supplies and such, so your recommendation this year is that we will only be supporting 2 in Tippecanoe County?
That's not our recommendation. That's what we understood was your preference.
That was from the corporate office of being able to, yeah, because I think the last few years, instead of 450 T-shirts, we've ended up more like 700, 800 T-shirts. And books and all of those other things. So the plan is, and I think, Michelle, we talked a little bit about this offline, is to select 2 or 3 schools that would be considered IU Health sponsored schools. And then if you, and we talked about this, so then those would be the main ones that would receive the IU Health volunteers from a strength and care standpoint, would receive the IU Health funds, receive the IU Health T-shirts, and receive the IU Health books and book bags. And then if there are volunteers from IU Health Arnett or wherever that want to volunteer at another school, they're absolutely more than welcome to volunteer at another school as, you know, a community member or whatever. But we're just trying to make sure that funds get used, because what happens is if there's 10 camps in one county, then it squeezes somebody else down to either 0 camps or 1 camp. And so we're just trying to make sure across the state we have good representation of camps.
Thank you.
Laura, do you want to offer anything else from Lafayette? I don't know if she's working on her computer, so you're unmuted, Laura, if you'd like. Okay, we can let that conversation take place as a follow-up. We had one question about get ready to read materials. Jim, I'll follow up with you. We do anticipate that you'll continue to use the same easel, that flip book that you use, and what we do is we buy additional sheets because those do have a copyright attached to them, so we'll be sending you some of those. But if you don't have enough of those easel books, we will send them to you in either English or Spanish. I have muted a couple of you, just Barry and Chrissy, so let me know if you would like to be unmuted because we were hearing a lot of background noise. Anyone else? Question? I see a question from Lori Hamer. Lori, did you have a question? We could barely hear you. Try it again.
On the list of counties where you'd like to see, reduced numbers of camps, I don't quite understand why Lawrence and Orange County is on that list.
I think it's more like, I think we did 4 or 5 camps last year, and they're looking at 3 or 4. Is that correct?
We did 1 in Orange County and 2 in Lawrence County for IU Health.
Right. So I think those numbers may actually be the same. I think it was how we counted all of your camps as kind of like Lafayette. We counted everything, not really just identifying that these camps are IU Health camps and the other camps are different camps.
All right, because there was one more that was sponsored and run a little differently, but Orange County only has 1 at all.
Okay. Yeah, that would not be reduced. We would want that still there. Thanks, Lori.
That would be the answer.
Hey, Laura, can you speak yet or not? Can we try?
Yeah, I think I can.
Yay!
I think I got it worked out.
Okay.
I'm sorry, what was the question in Orange County?
I had on an earlier slide that there was some question about the number of camps for Lawrence and Orange County. And since Orange only had 1 last year, I told her that actually IU Health indicated that you're okay with up to 2 in each if they can both be supported.
Okay, wonderful. Yes, thank you. That is correct.
Now, Laura,
Yes.
from Lafayette.
Yes. Our intention is to continue to expand the program. We will most likely be working with multiple classrooms in multiple schools, but for IU Health planning here, we can certainly identify 3 schools, probably the LSC schools, that they can adopt and focus on. And we've already identified our schools, and we're already in planning. We'll be at kindergarten roundup on March 17th, recruiting kids.
Fantastic. Okay, is there anyone else who has a question? I see Chrissy, do you have a question? That was an earlier question because I muted you. Anyone else have a question? You should all be unmuted. I muted Chrissy back, excuse me, if you wanted to speak. Anyone else have a question or a conversation? So for IU Health's knowledge, we had done, from an IUW perspective, we had started to survey our members about what their status was to date with their local communications with their schools, just trying to get a feel for the receptivity with their schools. Again, recognizing that some of our school systems are under a lot of pressure this year. So that is, we have that information. We don't have it completely from everyone yet, but we are working on getting that.
Lucinda, can you share the counties where you were talking about there might be some changes in leadership at the school level? What counties that might affect?
Okay, the one that we know of, and Steve West, I don't know if you are still on the phone, but your phone is unmuted. I understood that Dr. Stokes was had taken another position.
Right, she's gone.
Right, so we need to have, so that would be Blackford County.
I'll have to call the superintendent's office. I don't know if they know that they have a kindergarten countdown program.
Well, they should, because I know that there was a big letter writing campaign that went to a school board meeting last year thanking the school for letting kindergarten countdown happen. So that was
they've had their own program for years, and that's, I'm saying that they're aware they have a program.
Okay, gotcha.
Not sure that they know that there's a kindergarten countdown component to it.
Ah, gotcha.
So, but I'll call them.
Okay, and she was on my list as well to follow up with. So we know that there's a staff change there. I believe I've heard from a couple people that there might be some teacher changes, but not necessarily school administration changes. Are any of the others of you who are on the call aware that there are changes at the local school? You're all unmuted, by the way. Okay. I'm not hearing any.
So it appears maybe Blackford is the only county where there maybe could be some staffing changes or challenges with.
Yes.
Okay, great. Thank you.
And I think, I don't know if our folks from Muncie, I know that Jim had just started, there were some changes going on with some of the other funding. If you recall, in Muncie, the P3 grant was paying for a good part of those other camps. So there might be some changes in Muncie as well. Jim, I don't know if you're aware of any.
At this point, we're still hoping that we'll have the 5 across the city of Muncie, with one of those camps being supported by IU Health. That hasn't been confirmed yet, but that's kind of where we're looking.
Okay, great.
Hi, it's Steve West again. When I get a hold of the local county schools, besides me, who can they talk to?
That would
who
be.
should I put them in touch with?
Put them in touch with me, Lucinda Nord.
Okay.
And I will do some follow-up with them.
Okay, thank you.
Great. Just so that everybody knows, I know that we had this request last year and it just we weren't able to get it together in time. But we've had some requests from some of the teachers and some of the sites to put together little mini webinars, and we've now become a little adept at that we can put together a mini webinar around how to do the Get Ready to Read assessment, and so that can be shown to volunteers or teachers, just about sort of what we're expecting and how that can be organized in a most productive way. We really rely on our very experienced folks, like those in Lafayette with Amy, who has a lot of her time dedicated to just this effort, to help us with some of those best practices. And we do have a webinar that's already uploaded on our homepage. So again, if you go to iauw.org and scroll down, there's a link to a video, fairly short, I think less than 30 minutes, that gives more of the nuts and bolts of the camp itself. We plan on doing a couple more of those. And then, like I said, we'll be sending out the Get Ready to Read and some of those other tools and templates. So if there's something that all of you need, do let us know. We've, through United Way of Central Indiana, and through Lafayette and just the development over time, we have great examples of registration forms with the photo release and the T-shirt size, great examples of teacher contracts, how to do the insurance rider, how to do background checks, all of those kinds of things we have in different template tools already. Any other questions?
This is Jim from Delaware County again. Can we anticipate the same level of support from IU Health this year, or is that still being determined?
So from an IU Health perspective, one of the changes for 2015 is that they heard us where when we look at what a camp really costs, they recognize that the IU Health, the way we were dividing it, was not paying the full freight of that particular camp. So that's why IU Health has indicated that they would prefer to maybe minimize, or not minimize, but reduce the total number of camps that they were supporting, but to support them more fully. So you will probably receive at least as much. Now, what that will affect are camps, communities like LaPorte and Tippecanoe, and I will have follow-up conversations with LaPorte and Tippecanoe, because that funding will change, but for most of the others it will be the same or greater. Is that fair, Stephanie? Is that a fair reflection of our conversation?
Absolutely, yeah. So, yeah, I think I gave the example. I know it was close a year or so ago where we weren't sure if we were going to be able to pull off a camp down in Orange County, and there's just such a great need down there that we want to make sure that every community has one or even two camps to reach, as many kids as they can that really need it. So we just want to make sure that every county has the opportunity to make sure that their kids are reached through this program.
Yep.
So I will be getting with all of our IU Health, or excuse me, I said that wrong, all of our United Way partners statewide to ask for sort of what do you need from a budget perspective to support your intended camps that are going to be affiliated with IU Health. And then we will, again, back into that number of our total grant availability. And as I have mentioned before, we have other grant availability through IUW that we can help supplement if there's still not enough need, and then also support those other counties where IU Health is not present. So you will all be hearing from me, all of our United Way partners will be hearing from me very soon, probably within the day, of about the budget issue. Any other questions?
This is Stephanie. I don't have a question, but I did want to take the opportunity while we're on the phone to say thank you to everybody who makes Kindergarten Countdown possible in your local community. It's absolutely one of my favorite programs that we support and sponsor. And it's fantastic that we have pre and post assessments, so thank you for the time to make sure that that happens, that the kids are reached through such a great program. I know it's a big, heavy lift, particularly on the United Way front, and I just want to say thank you for partnering with us and making it happen. That I think you truly make a difference in these kids' lives, and we're just thrilled to be a part of it and to partner with each of you to make this happen. And I think we're going into, what, year 6, right? Mm-hmm. Year 6, so it's been a great long partnership, and I think we've really impacted, nearly 1,000 kids in the last 6 years, and it's certainly something that I hope everybody's proud of and feel good about not only the literacy improvements that we hope that these kids have at the end of the program and at the end of school, but hopefully improved health outcomes as making sure that they get on to a good start with their education. So thank you.
Great, and I echo that thanks. From a fundraising perspective, it's wonderful when we can engage in a long-term relationship and one that grows and increases over time. So we have really appreciated the relationship with IU Health, being able to show greater impact throughout the state with a common program. So we really appreciate that, and early education is both a programmatic and a policy priority for IUW. So we thank you all for your work. Are there any other questions before we wrap it up? All right. Well, let me see. I'm just checking to see if there are any other questions. Not seeing any.
Listen, this is Stephanie. I'll say I'm really thrilled to hear about the WebExes that you've developed around Kindergarten Countdown, and maybe more that you're going to do around Get Ready to Read. So I think that'd be a great asset tool, so thank you.
Super. All right. Well, on this Friday the 13th, we will offer you happy Valentine's Day weekend and happy Kindergarten Countdown camp planning for this summer. We look forward to working together. So if you haven't scheduled those meetings, get those scheduled. And if you have any corrections to the slides, let us know, and I will be in touch, as will Stephanie and Leah from IU Health. Thank you all.
Thank you.
Thanks.